Melek Yapa finds it difficult to play with her daughter Hayal today. She feels listless and has a headache. Her throat hurts as well.
I'll phone the doctor.
On her mobile phone, she has a list of important phone numbers, including that of her GP.
Praxisdoktor Elias, bitte schön.
The doctor's receptionist tells her that she could come to the medical practice in 2 hours. In every town in Germany, there are doctors who work in a medical practice and not in a hospital. It is better for whoever is ill, such as Melek Yapa, to report to GP, so that one does not have to wait too long. An appointment is important. The municipal citizens' advice centers or migration counseling offices, as well as the associations of SHI physicians, provide information on local GPs on their websites.
Do you have your insurance card?
Melek Yapa has a health card for her insurance fund. With a health card, you don't need the treatment authorization document by the Social Welfare Administration. Patients can take themselves to a doctor. In Germany, you choose which doctor to visit. Treatment is free to the patients. The doctor is fully booked up today. Therefore, Melek Yapa has to wait a while. She meets Mehdi Mohammadi, a friend from her neighborhood. He's next on the list. He's had serious back pains for a couple of days. Dr. Sami Elias immediately sees that the young man is not well. He examines Mehdi Mohammadi and wants a specialist to assess why his patient has back pains. The GP then refers the 33-year-old to an orthopedist who's a specialist well informed about bones, muscles and joints. In Germany, most GPs are general practitioners or interns. GPs can reliably help many patients. When necessary, the patients are referred to a specialist, as with Mehdi Mohammadi. These specialists also work in a medical practice and not in a hospital. The doctors can prescribe medicines from a pharmacy and treatments, for example, with a physiotherapist. In particular cases, the GP or the specialist will refer the patients to a hospital. Even when the doctor's medical practices are closed, one doesn't have to go to a hospital. At the weekend, on evenings and at night, patients can call the emergency medical service. Its phone number everywhere is 116 117. In the treatment room, Dr. Sami Elias asks the patient about her complaints.
I also have a headache, a cough and a fever.
Melek Yapa has her vaccination book with her. If the patient is attending a doctor for the first time, she should also have with her the documentation of earlier medical examinations. The doctor thus gets a quick overview. Say "Ah." The doctor now examines Melek Yapa. Her throat is inflamed. The lymph nodes are swollen. Doctors may not tell any third party what someone is ill from, including family members. There is a duty of professional secrecy.
Frau Yapa, Sie haben eine Mandelentzündung.
You have tonsillitis. The doctor prescribes a fever-lowering drug. Melek Yapa should lie in bed and drink a lot. Melek Yapa gets her medicine from a pharmacist. She has to pay a small contribution for the prescribed medicines. She should keep the receipt safe. Under certain circumstances, she can get some of the money back. You can get more information on this from the pharmacist or health insurance funds. This is about someone who is not well at all. The man on the trolley is complaining of a very intense pain in the upper abdomen. He felt really dizzy. This is why his neighbors notified the emergency services. In the hospital, the patient is brought to the emergency room. He was never really so out of it. He now also complains about chest pains, which is why the doctor suspects a heart attack. In hospital, the patients cannot choose who they will be treated by. Female doctors also treat men, and male doctors also treat women. In an emergency, one does not initially go to a GP. One should call the emergency services direct, especially if the condition of a person is declining rapidly. Throughout Germany, the emergency services have the phone number 112, and these are indications of an emergency: difficulty in breathing, sudden severe chest pains, acute stomach pains, or severe dizziness. Also, accidental injuries and severely bleeding wounds, burns and chemical burns, as well as complications in pregnancy are a case for a hospital. Similarly, disturbed or loss of consciousness, when someone does not react to being addressed or shaken or has slurred speech. Often the rescue coordination center still has questions about the emergency. Therefore, one should not just end a 112 call by oneself. But Melek Yapa has none of these, only tonsillitis. She would like to rest now.
Mama, I have a sore throat.
Her daughter has probably been infected, which is why Hayal will later go to the pediatrician with her daddy.